Then it is linked to physical illness. It is associated with diabetes, hypertension, and any other physical illness you can think of. So one serious aspect of it, which is becoming alarming also, is the fact that it is a risk factor for suicide. Suicide. So depression is a significant risk factor for suicidal thoughts and then behaviors. So male depression is a serious mental condition, yet many men try to ignore it or refuse treatment. So I think when the introductory remarks were being made, some of the speakers shared some experiences. So normally we ignore it or we refuse the treatment because of where we find ourselves or our cultural, environment. So the symptoms can differ between men and women as a result of the brain chemistry, hormones, life experiences, and then some traditional male roles that discourage the expression of emotions. So an example of a traditional role that would discourage a man from expressing his emotions is when you are a chief. Imagine they say you are the chief of this town or this area, and then like the first speaker, the MC said, you go for a funeral of a family member, and then you are crying all over the place. Society will not allow you. So certain brain chemistry that I also spoke about, and then the hormones. There are the male hormones as compared to the female hormones are also different. They play differently. So you see men behave in certain ways, unlike women. So like women with depression, men may feel sad, hopeless, or empty. Men may feel tired or have trouble sleeping, or too little or too much. I said that earlier. Then there's loss of pleasure in activities that they enjoy, and then they struggle mentally and emotionally with their daily lives. So there are behaviors that could give a signal that a man is suffering or battling depression. So there's problem getting along with spouse, partner, or the family. This is very common. You realize that in the house or in the home, there will be issues. There are always conflicts that they need to, settle or come to understanding to. And then the escapist behavior or excessive time at work or on sports. So he will want to escape certain situations, or rather he would like to spend more time at work. So by this time, everybody should be closing from work. It's 8:17. But this man, he still wants to be at work. He wants to stay there in order to escape the situation. Then the physical symptoms, there are complaints of headaches, and then there are digestive issues, and then there's pain. Most of the pain is unexplained. They complain of a particular pain. You run every lab, you give medications, but you realize that the pain still persists. Then there's problem with alcohol or drug use. You realize that once the man falls in this area, you realize that he tends to abuse or use substance more as a way to, curb whatever is happening. Then they become controlling, or they are violent. They become violent, and there is abusive behavior. Maybe this person was a very sociable, jovial person, but once this condition sets in, you realize that they become very irritable. The least thing they want to harm you, the least thing they are abusive, and most of the time with these behaviors, there's no sense of remorse. They do it and they don't feel anything. So there is irritability or anger that gets out of control. When it happens formally, you can just tap him on the shoulder, oh, my brother, and then it's fine. But this one, you cannot control it. Then there's risky behaviors. Some will start taking up risky behaviors like reckless driving or, indulging in activities which he will not do on the regular basis. So these are some of the signs that you need to watch out. So depression goes undiagnosed in men normally. It goes undiagnosed in men. Now, one is because They are not recognizing the signs of depression. Whatever is happening to them, they do not recognize those signs as depression. Two, they downplay the symptoms. So let's say all of a sudden he has become moody, he's withdrawn himself from the regular society. I mean, we downplay, oh, just leave him. I mean, we will pass certain comments, to that occasion. Then not wanting to talk about depressive symptoms. So a man, because of the fact that our cultural environment makes it that you don't talk about certain things even when it's happening to you. So you realize that he will not want to talk about his symptoms. Like he said, while he was reading the tribute, he got to a time he knew that no, I needed to cry, but no, you can't cry. So that is it. So male depression and suicide. So although women attempt suicide more often, men are more likely to complete it. Most women attempt suicide, and then most of them, they don't complete it. There are a lot of them. Yes, they will become dramatic. I mean, a woman who wants to commit suicide, she'll be calling you, if you don't come, I'll kill myself, or I'm killing myself. No, the man, no. He will either not talk about it. The day he talks about it, by the time you get there, executed, done, he's gone. So the growing crisis demands urgent attention. Also, men use methods that are more likely to cause death, such as guns. Straight, oh, he's gone. It's not now that people will come, miko ekoji, akuzreka. There's a country, I've forgotten the name. What they do is that, in Ghana, at some point in time, suicide was a criminal act, but it was decriminalized. So for us, anybody who is found attempting suicide or having suicidal thoughts, we take that as a serious case of mental illness. Because, we seated here, the moment you start thinking of suicide, it means you have a psychological problem. And the moment you do it, it means there's a mental problem that you are battling that perhaps it didn't come out for people to see it. So it's a serious issue. So in that country, what they do is that it is allowed. They even have institutions where they have a hotel. The hotel is actually for committing suicide. You go there are different types. Whichever means or method you want to use, you can have it. So when you go to the washroom, they have electrocuted the jacuzzi. So you can just go lie in, fill with some water, just press a button. You are gone. Some of the rooms have pistols that are loaded with bullets. So you can just use that method also. Some also have very sharp knives, depending on whichever method you want. So you just do it there. They call your family members. They come and pick you. What do you? Okay, so also men may act more suddenly in a moment on suicidal thoughts. Okay, and then they show fewer warning signs such as talking about suicide. Yes, like I said. Yes, some may talk about it, but most men will show few signs. They will not talk about it. They are quiet. The next minute, they are gone. Then also, they are more likely to turn to drug and alcohol use to cope with their suicidal. We don't know who to talk to. What happens sometimes is that people, unfortunately,